Hey guys, thanks for joining me. Today's video is going to be about what I used to think medicine was all about. So TV shows, pop culture, compared to what it's actually like. So we're going to talk about emergencies, CPR, flatlining, call rooms, paperwork, and is Dr. House right? Are all patients really lying to us? So comment below and let me know what you've seen in the media about medicine. I thought everything was stat. Like, you order blood work, stat. You get a CT scan, stat. And if anyone's remotely ill, stat. Turns out, things don't actually need to be stat. And when things are stat, it's a really big emergency, and then people move super quickly. Like, things get done so fast when someone is like bleeding to death or can't breathe. Like, that's when you see things move. But otherwise, you're actually juggling a ton of people, so everything actually isn't stat. So when a flat line happens and you see beep, and then obviously they grab the paddles and boom, they bring someone back to life. That's actually completely false. So when you see that flat line, there's actually nothing you can do but do CPR. That's the only, you actually can't shock that rhythm. And turns out, as I learned, shocking is actually like stopping a person's heart and then allowing the heart to restart itself. So this idea of shocking someone back to life, we're actually stopping their heart. CPR in TV show and movies looks pretty easy. One person going at it, they're basically just doing this. No problem. In reality, I am sweating when I'm the person doing CPR. Like, you actually will be drenching through clothes. It's hard work. People line up, so you have nurses, med students, residents, all of us lining up, and every 2 minutes, bam, someone switches, and it's hard. Arms are locked, you're using your whole body. So it's definitely not what they show in movies. Well, in Grey's Anatomy, they have bunk beds in their call rooms. I actually thought that's what I was gonna find when I went to a hospital. Turns out that's not true, and thank goodness, because if everyone's pagers and beepers and people were talking on the phone, like, that would be terrible and a little bit awkward. Doctors wear white coats, right? Okay, I can see why I was mistaken there, because a lot of doctors do, but actually there are a lot of doctors who don't, and I would say in the hospital I work at, probably most doctors don't. And in fact, most of the cities I've been to, most don't. And there's some different reasons. Some people say it's not as patriarchal and I'm higher than you, I'm wearing a white coat. And others say that, they wonder how often do doctors actually wash that white coat, and maybe it's actually not as clean to be wearing this white coat from room to room each time. You finish seeing someone, you write a prescription, and you move on to the next person. There's so much paperwork in medicine. Seriously. Like, you do something good, you have to document. You do something bad, you have to document. You're totally confused and have no idea what's going on. You have to document. When you finish medical school, you graduate, you're a doctor, you're a resident, and you know all the basics. And you can just go in, you can operate, you can diagnose everyone, you're good. Dr. House always says that patients always lie. You can never trust what they say. I guess I have no idea if that's true or not. Honestly, it feels like people open up, but maybe I'm being scammed this whole time. I don't know. I like to think the best of people. Luckily, the important things about medicine are actually what I expected. So you do get to make incredible connections with people and hear their stories and be there at an incredibly difficult time in their life. And you get to see people grow over time. You get to learn. It's so fulfilling. So those important things are actually what I expected.
Thanks for watching. Don't forget to like the video if you enjoyed it, and subscribe to follow all my experiences as a new medical resident.